Welcome back. Almost a year and a half later, the Ebola epidemic in 3 West African countries of Guinea, Liberia, and Sierra Leone is all but over. Liberia was declared Ebola-free, while Sierra Leone is on the path to be declared Ebola-free. VOA's Jackson Mvunganyi was recently in Liberia and Sierra Leone to look at the impact of Ebola on both countries. Jackson is joining us in the studio to tell us more. Jackson, welcome to the show.
Thank you, Linord.
So how was the situation in both countries when you went there, and why did it take so long for government really to respond in terms of containing the infection?
Well, life is relatively back to normal in both countries that I visited. I was in Monrovia for about 5 days and in Freetown for about 2 days. And life is getting back to, the relative normality. And why it took long for them to respond to the situation? Well, for starters, there was a bit of suspicion from these two communities. They don't really believe what the government tells them. Face value, and in Liberia, it was after the death of a leading politician that people started, recognizing that this was a problem, that they should be worried. In Freetown, in Sierra Leone, actually, the whole of Sierra Leone, it was after the death of 2 leading doctors that passed away because of contracting Ebola through, helping out people who had, the disease. The situation is getting back to normal. Most people feel like the rough days are behind them. Sierra Leone is counting down. I think it has a little over 20 days to be considered Ebola-free, declared Ebola-free by the WHO. And when I spoke to the spokesman, the government spokesman, Abdoulaye Berete, he told me this.
Okay.
We are exercising an optimism of caution, because the President, Dr. Ernest Bai Koroma, in all his broadcasts, has indicated that even though we are on a countdown, we must be mindful that Ebola is still with us, and we must not compromise both the medical measures that we have put in place as a government, as well as hyping up on the social mobilization. So far, that is where we are, and the country, everybody is on us with that, so that we'll make sure collectively as a nation, once we are declared free, we can celebrate together.
So what did Mr. Berete say in terms of some of the lessons learned with regards to responding to future health crises?
Well, they learned that, first of all, they need a robust healthcare system. They learned that they have to have a better communication with their citizens. Some of the issues they are tackling specifically is they have been educating the healthcare workers in how to handle some of these cases of Ebola. They've gone to traditional healers and traditional leaders in their communities and told them that they have to be very cautious. They've trained them. They have set up a toll-free number, 117. If you suspect somebody has Ebola, you call that toll-free numbers and they will dispatch healthcare workers to come and respond. They've also instituted what they call barrier teams, safe barrier teams, who come and collect people who have passed away because of Ebola and bury them in a safe place.
Now, it's interesting that you mentioned traditional healers, because we saw earlier in the piece that in Guinea, basically the message was, be careful, do not try to treat Ebola on your own. Right. What was the message?
Well, they have to work. There's a concerted effort to reach out to these traditional healers. These are communities that strongly use community healers. In Liberia, in Guinea and Sierra Leone, community healers or traditional doctors are very much used by people who have, whatever ailment they have, they'll go to them. And during the crisis, the Ebola crisis, many of them went to visit their traditional healers, and because of that, they did not receive adequate medical care. So what they're partnering with them and telling them, if you have somebody who you suspect to have Ebola, send them to us or call us so that we can respond. Do not take the matters into your own hands anymore.
What were some of your observations in terms of the lasting effects of Ebola on these communities?
Some of the lasting effects, I believe, that they will have to deal with for a long time is stigma. Many people still live under the shadows of Ebola. The people who are the first responders, unfortunately, the nurses, women, mothers in their families and their communities are stigmatized if they came in contact with Ebola at any point. And so that is one of the residual effects that they will have to deal with at a long time.
And quickly, Tell us about one or two strategies that they're put in place.
Well, there are a couple of strategies, the post-Ebola recovery strategies that both countries are putting in place. One is that they're going to revamp the economy. In some places in Western Sierra Leone, they're giving away cash handouts. It's a pilot program that is being supported by the World Bank, where the government is giving cash to families that are living below poverty line. And they're also trying to find a way to streamline service delivery in many of these communities where healthcare had really broken down.
Okay, well, excellent reporting, Jackson.
Thank you.
Thank you so much for joining us. And our thanks to VOA's Jackson Mvunganyi.